Hello and welcome to this Fitech screencast. Today we'll be looking at the medical area, in particular the techniques that we have to assess coronary risk. We've got three. The cardiac risk JBS is exclusively for the UK. The other two are certainly global. What we'll do is we'll have a quick look at the cardiac risk one. You obviously have to load up a subject, and I've done that. And what you get is an interface. There's a bar graph on the top. You've got the current risk parameters to the left and potential risk parameters to the right. So the idea is that you ensure that all of the necessary data for the technique has been gathered. If it hasn't, you can just click on change current risk and then modify them as appropriate. On the right hand side, you modify the things that could be changed in order to see an improvement. So in this particular case, we can see that we've gone from smoker to non-smoker, and we've reduced the blood pressure and increased the HDL and lowered the cholesterol, which is completely feasible given a combination of exercise, drugs and medical advice and so forth. And what we have up here is the bar chart. We can see the potential improvement here and the actual risk here. So you can see straight away there that this individual is in the medium risk area, and if you look at the text down here, for an individual of his age, the norms would be between 4 and 7%. The actual risk is 25%. So this individual is significantly higher risk of a coronary event against his peers for his particular age group. Now if we just click on the See the Improvement button here, that will add a little bit more text here. I've not modified any of them, but you can see there that there's a potential improvement of 23%. So it's gone from 25 to 2%. Which is significant. This is particularly useful when you show the subject this, because they'll realize that if they can modify some of these things, which can be modified, then there is a greater chance of them not having a coronary event. In the case of Framingham, it's over 5 years. There's a useful standalone report which you can launch by clicking the generate report link, and that will give you a little bit more information about the technique and the statistics and the graph, etc. So it's a very useful test. It's quite good shock therapy for those people who maybe not got the greatest lifestyle in the world. Now what we'll do is we'll have a quick look at Dundee. Dundee's a slightly different system, and again it relies on a certain number of parameters. They all have roughly the same parameters, but some have one or two other different ones. This basically works on a queue basis. So his current parameters indicate that he's at the front of the queue for a coronary event, whereas the potential risk factors here, which we've input and updated, have put him pretty much near the back of the queue. So he's actually 99th. So the queue is there's 100 people in the queue, and you can see here his current ranking is 0, so he's right at the front of the queue. Hence the long red bar, and he's most at risk. The potential factors, if you can get down to those, mean that he's actually right at the back of the queue. So that's the difference really in Dundee and Framingham, and that's really all I want to explain. Again, you can run a standalone report. From an individual report, again all this information is available if you choose to select it. Thank you for watching.